Hello, Mr. Jones. My name's Tiffany. I'm going to be your nurse today. So we have orders here from the doctor to change. We have some standing orders to change your central line dressing. It's been over 7 days, so we're going to do that today. And we have our order set here, which you will all have. All right, so cleaning my hands. We're going to get some privacy real quick. Just for the sake of this video, we'll keep it. So we're going to pull this curtain around, get some privacy. Go ahead and raise your head up. Raise your bed up to a good working height here. That's cool. All right. Mr. Jones, can you please tell me your full name and date of birth?
George Monster Jones, 101XX.
Yes, and I'm going to verify that with our chart here and the order from the physician. We have an order to perform a sterile central line dressing change weekly and as needed. So I see yours was done over a week ago, so we're going to do that today. Alrighty, so Mr. Jones, can you tell me, are you allergic to any cleansing agents such as alcohol or chlorhexidine?
No.
Okay, perfect. So that's what we're going to use to clean with. I'm going to go ahead and lay you flat. And if you have any trouble breathing or need to sit up, please let me know. I'll lay you flat, and I'm going to go ahead and put this rail down. And I'm going to put this bed up a little bit more so we're not leaned over. Okay, Mr. Jones, I am going to go ahead and get my supplies up here closer. I'm going to put my mask on. All right, Mr. Jones, I'm going to wear this mask, and I'm going to have you turn your head to the left, away from your central line site, because I'm going to open it up, and I don't want anything to get contaminated, no pathogens or bacteria into that site. All right, I've already cleansed my hands earlier. I'm going to go ahead and put on gloves. All right. I hate these gloves too. Okay. All right, Mr. Jones, I'm going to go ahead and start taking up this dressing. So we're going to kind of peel up the edges. We're going to go towards the catheter insertion site. We're going to get it started. This one's really sticky. We're going to be sure not to touch the actual catheter insertion site. It's literally falling apart. Doing okay?
Yes.
Good. I'm trying to hurry, but this stuff is stuck. Okay. This whole line is sticky here. All right, so we got the old dressing off. Now, I'm going to take my regular gloves off. We are going to throw them in the trash, and we're going to perform hand hygiene again. Cleaning our hands real good. Now that we've got the old dressing off, we're going to set up our sterile field here. We're going to get ready to put on the new dressing. Okay. I'm going to go ahead and open this. I'm going to open it away from us. Move that to the side. This you can turn around and you can touch the outside, but you want to open it away from you. So I'm going to pull it, open it away, and then from side to side. Remember, you can only touch the 1-inch border on the outside of it. And sometimes it will kind of fold back up on you, but okay. Now, we don't need the mask. We can take the mask out, move it to the side. We're going to take our gloves. we are going to open our sterile gloves over here right with the patient at the bedside. Okay, I'm gonna pinch the first one. And then I'm gonna cuff the second glove with my thumb out. Okay. Alrighty, and we can just kind of, now that we've got our sterile gloves on, we have the side open. We are first going to take, we can move some of this out of the way. We're gonna take our chlorhexidine sponge, we're gonna pop it, and we're gonna clean in a back and forth motion for 20 seconds. Okay, scrubbing the area, scrubbing the actual site, scrubbing the tubing, okay? I'm not gonna touch anywhere, we're just cleaning it real good. Once we're done, we can put that anywhere. I don't want it to go back on our sterile film. Okay, now it's good and clean. We're gonna allow it to air dry. Okay, so we cleaned it 20 seconds, allow it to air dry. Alrighty. Now, we are going to go ahead and take our dressing. We're gonna peel the backing off and away from us. Make sure not to touch the middle or the sticky part. We're gonna line this up in the window where we want it at. And once we have it where we want it, we're gonna lay it down flat and go ahead and press it in the center. Okay? We're gonna find the spot here and start peeling the edges where it's kind of, where it comes together here. Okay, and we'll use one finger to press it down as we peel the border. Alrighty, now that we have that in place, everything's cleaned and covered now, we're done with the sterile part. So once we have the dressing in place, we're gonna take our label, we're gonna put the date, time, and initials, and peel this off, place it anywhere on the edge of our new dressing. We'll put it down here just to kind of maybe keep that looped up and out of the way. Alrighty, now that we're done, we're gonna take all of our supplies and we're gonna throw them in the trash. Okay, take all our supplies down. We are gonna take off our gloves, clean our hands again. Okay, and we are going to put Mr. Jones back together. All right, Mr. Jones, we're all done. Your central line's done. I'm gonna raise your rail up, put your bed back down to the ground. You can go ahead and turn your head back too, so that's comfortable. I'm gonna raise your head up once we get back all the way to the ground. Okay, and we ensure that their bedside table and call light are in reach.